Welcome to the Deep Dive Learner. Today, we are basically tearing up everything you thought you knew about human physiology.
Yeah, it's a total paradigm shift.
It really is.
Okay.
Because, when you picture a medical transformation, you probably think of like a targeted fix. You take an antibiotic for a specific infection, or you put a cast on a broken bone.
Right, the intervention is localized. It's contained to one area.
Exactly. But then you open up today's source material, a really comprehensive clinical text on maternal physiology, and you realize that pregnancy just shatters that illusion entirely.
It really does. It requires us to abandon the idea of the body as this machine where you can tune up one specific engine without disturbing the rest of the factory.
Yeah, because growing a human being is not a localized event. It is a complete, systemic, wall-to-wall overhaul of the human body.
Every single system, from the cardiovascular network down to the skeletal structure and the immune system, they all have to fundamentally rewrite their own operating protocols.
And that is our mission for you today. We are unpacking the mind-blowing anatomical and physiological adaptations a woman's body undergoes during pregnancy.
We're taking this incredibly dense medical textbook and translating the sheer mechanics of it into something you can actually visualize.
Right. Okay, let's unpack this. And I think we should start with the timeline and the ultimate goal.
So to set a quick baseline, gestation lasts about 40 weeks. We measure that as 280 days from the last menstrual period, and it's divided into 3 trimesters.
But the real story here is the why, right? The purpose behind these drastic changes.
Exactly. Every single adaptation we are going to discuss serves 3 distinct goals. First, to protect the mother's normal physiological functioning. Second, to meet absolutely extreme metabolic demands.
And third, to build a secure, nurturing environment for fetal development.
Right. You can't have one without the other 2.
Which makes sense. And before the body can physically expand to accommodate a fetus, it has to ramp up its supply lines.
It really is a lot like trying to build a massive new addition onto your house while you are still actively living inside it.
Oh, that's a perfect way to put it. You can't construct a new biological structure without a massive influx of raw materials.
Which means the cardiovascular and respiratory plumbing requires a supercharged upgrade before literally anything else can happen.
So let's talk numbers. Because when you look at the raw data, it's staggering. Yeah. To sustain the uterus and the developing placenta, the total blood volume in a pregnant woman's body increases by 40 to 45%.
Right. We are talking about adding extra 1,200 to 1,600 milliliters of blood to the circulatory system.
Which is basically pouring a large soda bottle of extra fluid into the closed loop of the human body. And that peaks right around 32 weeks, right?
Yes, exactly. And pushing that extra fluid around requires the heart to work major overtime. Cardiac output jumps 30 to 50%.
Wow.
And the resting heart rate increases by 15 to 20 beats per minute and just stays elevated.
And the heart itself actually changes, right?
It does. The physical heart muscle undergoes slight hypertrophy, meaning it actually enlarges. And because the diaphragm is eventually pushed up by the growing uterus, the heart is physically displaced upward and rotated forward to the left inside the chest cavity.
So the cardiovascular system is essentially remodeling the chest cavity to fit its new workload.
That is wild.
It is, but the composition of that extra blood is where the source material gets into some really fascinating mechanics.
Yeah, the text brings up this term, physiologic anemia, which sounds bad. Normally, anemia implies a dangerous deficiency, but here it's a calculated adaptation.
Right, it's totally intentional.
The best way to visualize it is like making a pot of chicken noodle soup. Say you have a normal balanced pot of soup, but then you dump in 4 cups of extra broth and only like 1 cup of extra noodles.
You technically have more soup overall.
Exactly, but it's watered down. The ratio shifts completely.
That's exactly what happens.
Yeah.
In pregnancy, the body does produce more red blood cells, the noodles in your analogy. But the blood plasma, the liquid broth, increases at a much faster rate. So the overall concentration of red blood cells drops,
resulting in a state of hemodilution. It actually lowers the blood's viscosity, which makes it easier for the heart to pump that massive new volume through the delicate blood vessels of the placenta.
But the text also points out a seemingly contradictory mechanism here. The blood is watered down, sure, but it also becomes thicker in terms of its clotting ability.
Yes, pregnancy induces a hypercoagulable state.
Which sounds dangerous, but it's a protective thing, right?
It is a vital evolutionary protective mechanism. The body intentionally produces higher levels of circulating clotting factors.
To prevent bleeding during birth.
Exactly. It is entirely designed to prevent the mother from experiencing catastrophic bleeding during the separation of the placenta at birth.
But there's a trade-off.
A significant one. This thicker, clot-prone blood raises the maternal risk for thromboembolism, or dangerous blood clots, particularly in the lower legs.
Right, and while all this altered blood is pumping around, the respiratory system is having to supply oxygen for two.
Oh, absolutely. Oxygen consumption goes up 20 to 40%.
But the sheer mechanics of breathing get really complicated because as the uterus grows, it pushes the diaphragm, which is your primary breathing muscle, upward by as much as 4 centimeters.
So the body has to force a mechanical switch. To get enough oxygen when the diaphragm is restricted like that, the mother actually transitions from abdominal breathing to thoracic or chest breathing.
The rib cage actually flares out, right?
Yeah. The transverse diameter of the chest expands by about 2 centimeters just to make room for the lungs to inflate laterally.
That is unbelievable. And biochemically, the respiratory system alters its baseline as well. The body enters a state of chronic, mild hyperventilation known as respiratory alkalosis.
And the chemistry of this gas exchange is just brilliant. Progesterone makes the brain's respiratory center hypersensitive to carbon dioxide.
So the mother breathes slightly faster and deeper, exhaling more CO2 than normal.
Right, which lowers the carbon dioxide concentration in her own bloodstream. And by dropping her own CO2 levels, she creates a steep concentration gradient across the placenta.
Because her blood has less CO2 than the fetus's blood.
Exactly. So the waste CO2 from the fetus naturally diffuses across the barrier into her bloodstream so she can exhale it.
The physics of that gas exchange are so incredibly precise.
What's fascinating here is how the body manages the pressure in the plumbing with all this going on.
Right, because you're adding 1.5 liters of fluid to a closed loop and increasing the cardiac output by half. Under normal circumstances, maternal blood pressure would skyrocket.
It would literally burst the pipes.
Yeah, if you turn up the water volume in your house by 50%, the pressure gauges are going to redline.
But maternal blood pressure typically stays the same or even drops slightly, especially in the second trimester.
And that's because of the hormones, right?
Yes. The systemic vascular resistance drops by 30 to 50% because hormones like progesterone and relaxin act directly on the smooth muscle walls of the blood vessels.
They literally relax and dilate the vessels, widening the pipes so the extra blood can flow smoothly without increasing the pressure against the walls.
Which brings us to the inevitable physical problem of real estate.
Right.
The cardiovascular engine is supercharged, the pipes are widened, and all that extra blood is rushing to feed an organ that is growing at an explosive, almost unbelievable rate.
Here's where it gets really interesting. The expansion of the uterus is just a masterclass in spatial adaptation.
It really is.
Before pregnancy, a normal uterus has a volume of about 10 milliliters. It weighs roughly 70 grams. By 7 weeks, it's the size of a hen's egg.
And by term, that same organ has a volume of 5 liters and weighs 1,200 grams.
It goes from the size of a small lime to a massive fluid-filled watermelon, entirely trapped inside the abdominal cavity.
And as it expands, it systematically displaces nearly every other organ in the abdomen.
It's a game of internal Tetris.
Exactly. It pushes the intestines entirely out of the normal pelvic space, shoving them upward and laterally against the abdominal walls.
It even displaces the appendix.
Yes, moving it high and to the right side of the abdomen, which is why diagnosing appendicitis in a pregnant woman is notoriously difficult. The pain just isn't located in the anatomical lower right quadrant where a doctor would normally look.
The urinary system takes some of the heaviest hits, too. Early in the first trimester, the lower segment of the uterus dramatically softens a clinical marker called the Hagar sign.
And because it softens, the entire heavy upper portion of the uterus essentially flops forward, resting directly on the bladder.
Which causes that classic frequent urination of early pregnancy.
Right. And later, as the uterus grows upward into the abdomen, the bladder gets a brief reprieve until the end of the third trimester when the sheer weight of a fully grown fetus drops down and compresses it all over again.
And it's not just the bladder. The kidneys and ureters are equally impacted. The kidneys actually enlarge slightly to filter the increased metabolic waste from both the mother and the fetus.
But the ureters, the tubes connecting the kidneys to the bladder, have to navigate around this massive 5-liter obstacle.
So they physically elongate, dilate, and become tortuous.
Yeah, they form bends and curves just to stretch around the uterus.
It creates a kink in the garden hose. That tortuous shape slows down the flow of urine, creating urinary stasis.
And when urine pools inside those curves instead of flushing straight through, bacteria have time to multiply.
which is why the risk of urinary tract infections skyrockets during pregnancy.
Exactly. And the gastrointestinal tract suffers a very similar slowdown, but for chemical reasons. We noted earlier that progesterone relaxes the smooth muscles of the blood vessels.
Right.
Well, it does the exact same thing to the smooth muscles of the GI tract. The esophageal sphincter, which is supposed to stay tightly closed to keep stomach acid down, becomes lax.
Oh, hello, heartburn and acid reflux.
Yeah, severe heartburn. And further down, stomach emptying slows, and the peristalsis, the wave-like muscle contractions in the intestines, become sluggish, leading to significant constipation.
And the sheer mechanical weight of the uterus interacts dangerously with the cardiovascular system we just talked about. The text outlines supine hypotensive syndrome.
This is a major one.
Yeah. If a woman lies flat on her back in the second half of pregnancy, that massive 1,200-gram uterus can literally crush her inferior vena cava, which is the main vein responsible for returning blood from the lower body back to the heart.
And crushing that vein can drop her cardiac output by up to half within a matter of minutes.
Wow.
The maternal blood pressure plummets, cutting off circulation and causing her to feel incredibly faint.
This physiological bottleneck is the primary reason pregnant women are advised to sleep on their sides, particularly the left side, to utilize gravity to keep the heavy uterus off the major abdominal blood vessels.
Right. And I want to touch on the gastrointestinal symptoms again to clarify a major point from the source text regarding morning sickness.
Oh yeah, the text notes that up to 80% of pregnant women experience nausea and vomiting. But calling it morning sickness is a complete misnomer.
It really is.
Only about half of women who experience it actually have symptoms isolated to the morning hours. For a vast number of women, it hits in the evening, or it's a relentless, all-day physiological response.
And the leading theory presented by researchers suggests this is not a glitch, but an evolutionary adaptation.
An adaptation to protect the baby, right?
Exactly. The nausea peaks perfectly in sync with fetal organogenesis.
Which is that highly vulnerable window in the first trimester when the fetus's major organs are forming.
Right. The aversion to certain tastes and smells likely evolved to protect the developing embryo from potentially dangerous foods or toxins in the maternal diet during its most fragile state.
That makes so much sense. And while the stomach is rejecting certain foods, the gut microbiome further down the digestive tract is undergoing this radical, deliberate curation.
As the pregnancy progresses, the overall diversity of the maternal gut bacteria actually drops, but the total number of bacteria increases.
The body is essentially weeding out the diverse garden to mass produce a very specific crop of bacteria.
The mother's body alters its microbiome to influence her own metabolism, helping her extract and store more energy from her food to feed the fetus.
But more profoundly, she is cultivating a specific bacterial profile to establish the neonate's very first microbiome during birth.
Yes, the mother's biology is preparing the precise strains of bacteria the infant will need to digest milk and begin building its own immune system.
But curating a microbiome while simultaneously shoving organs around and pumping an extra 1.5 liters of blood requires a master control system.
It does.
The body orchestrates this massive physical reorganization through a highly coordinated chemical and hormonal ballet. And a huge component of that control relies on the immune system.
And here's where a really common myth comes in. People suggest pregnant women are simply walking around immunosuppressed so their bodies don't reject the fetus.
Right, but the source material explicitly rejects that idea.
Pregnancy is absolutely not a state of systemic immunosuppression. Rather, the immune system engages in a constant state of calculated, highly localized flux. It actually operates in 3 distinct phases.
Okay, break those down for us.
In the first trimester, the immune system is actually pro-inflammatory. Inflammation is biologically necessary to successfully implant the embryo into the uterine lining and to establish the vascular connections of the placenta.
So it starts with inflammation, not suppression.
Yes. Then, in the second trimester, the system flips to a predominantly anti-inflammatory state.
Because that's the period of rapid fetal growth.
Exactly. So the maternal immune system quiets down locally to allow the fetus to develop without interference. Finally, in the third trimester, it shifts back to a pro-inflammatory state.
To trigger labor, right.
Yes, an influx of inflammatory immune cells into the uterine muscle is a primary trigger for cervical ripening and the onset of labor.
But the underlying genetic reality is that half of the fetus's DNA comes from the father. It is a foreign entity.
It is.
If the mother isn't immunosuppressed, The mechanism keeping her immune cells from attacking the fetus has to be incredibly targeted.
And that's where the placenta comes in. It essentially acts like a bouncer at an exclusive club, deciding which maternal immune cells get to interact with the fetus and which get neutralized.
That is such a cool analogy.
The placenta is far more than just a nutrient filter. It is an active, regulating immune organ. It secretes specific signals and factors that actively regulate the differentiation and function of the mother's immune cells.
It's basically communicating with the maternal system, signaling it to recognize the foreign fetal tissue, but to tolerate it rather than attack.
It is an ongoing 9-month chemical negotiation.
And that chemical negotiation extends heavily into the endocrine system, where hormones are doing some heavy lifting, sometimes working in direct opposition to the mother's own health.
Yes, the text details endocrine antagonism. Hormones produced by the placenta, such as human placental lactogen, along with cortisol from the adrenal glands, actively function as insulin antagonists.
Meaning they decrease the mother's tissue sensitivity to her own insulin.
Exactly. By making the mother's cells temporarily insulin resistant, her body takes up less glucose from her bloodstream,
That leaves a higher concentration of glucose circulating in her blood.
which then freely crosses the placenta to provide a constant energy source for the rapidly growing fetus.
It's a metabolic fast track to feed the baby, but it puts an incredible strain on the mother. To keep her own blood sugar from spiraling into dangerous territory, the mother's pancreas has to work overtime.
The insulin-producing beta cells in her pancreas undergo hypertrophy. They physically grow larger just to pump out enough extra insulin to overpower the placental hormones and maintain balance.
And all of this extra blood flow, combined with these extreme hormonal surges, leads to some bizarre, highly specific symptoms that aren't typically associated with a textbook pregnancy.
If we connect this to the bigger picture, it explains so much.
Like epulus, which is swollen, bleeding gums, or teolism, which is the excessive, uncontrollable production of saliva.
And then there are the respiratory symptoms: severe nasal congestion, epistaxis or frequent nosebleeds, and even unexplained earaches.
Earaches. How does that even happen?
The mechanism behind these symptoms all traces back to the cardiovascular engine upgrade. The massive increase in total blood volume, paired with elevated estrogen levels, causes the capillary networks in the body's mucous membranes to become intensely engorged and fragile.
So the tissues in the nose, the gums, the pharynx, and even the eustachian tubes in the ears literally swell with extra blood.
Exactly. A pregnant woman might feel like she has a constant, unrelenting cold or impaired hearing, simply because her respiratory and auditory plumbing is swollen shut by her own vascular system.
And her gums bleed when she brushes her teeth because the capillaries are stretched to their absolute limit.
The internal mechanisms are hidden, but the outward manifestations eventually become just as dramatic. As the uterus expands outward and forward, the entire musculoskeletal system has to compensate for a drastic shift in the body's center of gravity.
To avoid falling forward, the maternal spine develops lordosis, an exaggerated backward curve in the lower lumbar region.
And this realignment, combined with loosened joints, creates the classic pregnant waddling gait.
And the joints loosen specifically because of the hormone relaxin, right?
Yes. It does exactly what its name implies. It breaks down the rigidity of the ligamentous structures to prepare the pelvis for birth.
So the sacroiliac joints in the back and the symphysis pubis, the joint connecting the two halves of the pelvis in the front, actually widen and become highly mobile.
The structural integrity of the skeleton itself softens. Even the abdominal muscles, the rectus abdominis, can physically separate down the middle to make room for the uterus, a condition called diastasis recti.
Wow. And the integumentary system, the skin, also acts as a canvas for this hormonal surge.
It does. The anterior pituitary gland spikes its production of melanotropin, leading to distinct hyperpigmentation.
Like melasma, often called the mask of pregnancy, which causes dark, blotchy patches on the face, and the linea nigra, the pigmented line that develops down the center of the abdomen.
The high estrogen levels also cause vascular spiders, or angiomata, to appear on the neck and arms, and palmar erythema, where the palms become noticeably red and blotchy due to the localized increased blood flow.
The body is curving its spine, altering its skin pigmentation, and separating its muscles. But long before a doctor can observe these outward signs, the mother often senses the systemic overhaul internally.
The source text uses the term quickening to describe the moment the mother first feels the fetus move, usually between 14 and 18 weeks.
Early on, it's a light flutter that is easily confused with normal intestinal peristalsis.
Clinically, doctors confirm the physical presence through ballottement, tapping the cervix to feel the floating fetus gently bounce back against the examiner's finger.
Or by observing Braxton Hicks, the uterus performing practice contractions to prepare for labor without actually dilating the cervix.
But if we trace this entire massive systemic process back to its absolute origin point, it all begins with one specific biological marker, HCG, or human chorionic gonadotropin.
The production of HCG begins almost immediately after the embryo implants into the uterine wall. It serves as the chemical flare gun that tells the corpus luteum in the ovary to keep producing estrogen and progesterone, preventing the mother's menstrual cycle from shedding the lining until the placenta is mature enough to take over hormone production.
And early in pregnancy, the levels of HCG are so explosive that they double every 2 days.
That exponential rise in HCG is the precise chemical marker that at-home pregnancy tests are designed to detect. They utilize a mechanism known as a sandwich-type immunoassay.
The chemistry engineered into these over-the-counter plastic sticks is remarkable.
It really is. Inside the test strip, there is a reaction zone containing freely moving antibodies that have a specific color-changing enzyme attached to them. When urine containing HCG washes over this zone, the HCG molecules bind to these enzyme-linked antibodies.
The urine then carries these bound molecules down the strip via capillary action to a second zone.
And this test zone contains fixed antibodies anchored to the strip. These fixed antibodies grab the other side of the HCG molecule.
So the HCG is effectively caught between the two antibodies, like meat in a sandwich.
Exactly. And once that specific sandwich is formed, the enzyme is locked in place and triggers a chemical reaction with a dye, producing the visible positive line.
This raises an important question, though. Because it is brilliant biochemistry, however, the source material points out a critical flaw in relying on this technology.
Human error.
Yes. The biology of the test is highly advanced, but the accuracy frequently breaks down due to human error and health literacy barriers.
The text explicitly notes that the instruction inserts for many of these tests are written at a 7th grade reading level or higher, and they often fail to comply with plain language guidelines.
The chemistry works perfectly, but if the user cannot decipher the dense instructions, the tool is useless.
And the most common human error is simply taking the test too early.
Right. If a woman takes the test before the HCG levels have had enough time to exponentially double and reach the strip's detectable threshold, the antibodies won't have enough meat to form the sandwich.
She will get a false negative, not because the pregnancy isn't happening, but because the chemical signal isn't loud enough yet.
It serves as a reminder that understanding health is just as critical as the medical technology itself.
So what does this all mean for you, the learner? We started this deep dive by comparing a normal medical diagnosis to fixing a localized issue, like a broken pipe, clean and contained.
But the reality we've uncovered today is that growing a human life is the exact opposite.
It requires watering down the mother's blood, physically shoving her vital organs out of their anatomical homes, chemically relaxing her blood vessels, loosening her actual skeleton, making her resistant to her own insulin, and completely rewriting the operating protocols of her immune system.
It is a temporary, highly orchestrated re-engineering of the entire human organism.
It is absolute biological magic, hidden behind the mundane realities of heartburn, bleeding gums, and a waddling gait.
It really is.
But before we wrap up, there's one final provocative thought from the source material that you should take with you, and it goes back to the maternal microbiome.
Right. The text notes that the mother's vaginal and gut microbiomes fundamentally alter during pregnancy, specifically to help establish the neonatal microbiome during birth.
Think about the lifelong implications of that one localized adaptation. The mother's body completely re-engineers its own bacterial makeup, literally changing the ecosystem of her own gut and body just to seed the baby's very first bacteria.
It's incredible to think about.
How much of our own lifelong health is determined right in that moment? How much of your daily digestion, your baseline immune function, and your overall physical resilience is simply an echo of the temporary bacterial environment your mother meticulously curated for you in those specific 40 weeks?
It's a huge question.
We like our medicine precise. We like the clean x-ray showing the broken bone. But the reality of human life is infinitely messier, deeply interconnected, and far more brilliant than a simple machine. Thank you for joining us on this deep dive, learner. Stay insanely curious, and we'll catch you next time.